And we welcome you back to the Wellness Conversation, an OhioHealth podcast. I'm Marcus Thorpe.
And I'm Lindsey Gordon. First, we have some great news to share. Our podcast is growing, and we want to thank you for that. More listeners than ever, more subscribers each month, more plays, more downloads. This is very exciting for our team, and you've helped us get here. So thank you so much. If you're new here, please like this episode, rate the podcast, and subscribe to help others find us too. It is so important, and we can't thank you enough.
And today we're tackling a very important topic for athletes, the weekend warrior out there, everyday folks, kids. We're talking about concussions, and we are pleased to be joined by Dr. Ben Bring, who's a sports medicine physician, as well as Dr. Obi Moneme, who is a neurologist, both at OhioHealth. We'd like to welcome you both to the conversation. Thanks for being with us.
Yeah, thanks for having us.
Yeah, thanks for having us.
It's going to be a great conversation. Let's start from the very beginning because, look, concussions can be a very confusing topic. Not everybody knows, do I have a concussion? Do I don't? What's going on when this happens? From a medical term, sports headlines, we see it a lot. What is an actual concussion? Dr. Moneme, you want to kick us off?
Sure. Yeah, I can start there. So I think the guidelines and the definition has changed over time, but really the most accurate guideline or concussion definition is a traumatic brain injury that comes from a direct blow either to the head, the neck, or the body that causes neurological symptoms. Right? I think when you kind of frame it in that way, that encompasses all the different ways that someone can suffer a concussion.
Okay.
I think that's a great way to think about it because I was just actually thinking about this while you were speaking. Last night, my kids were roughhousing and they bonked heads, and it was enough for a bump to form on both heads. And so we grabbed the frozen peas, we wrapped it in the paper towel, and I've always heard a bump is better than a dent, and this is going to happen with kids, but I went down the rabbit hole in my brain. I'm like, is this a concussion? Do I need to get them in? What do I do? Do I call the doctor? And so I just say that to say concussions don't just happen on the field. They happen in everyday life. They happen crazy times. And so when we talk about a concussion, are we talking about a bruise on the brain? Or are we talking about more than that? And Dr. Moneme, you kind of already alluded to that, but there's definitely something more than just a bump on a head there, right?
Yeah, I think the other thing we looked for, too, are symptoms. So the biggest ones we'll see, especially in kids, are fatigue, sleep issues, sometimes even depression, anxiety can get worse, headache, head pressure, nausea, too. Those are some of the more common symptoms that we'll see. On a molecular level, the way I like to explain it to patients is in our brain we have a lot of neurons. The neurons help us transmit signals, helps our processing, helps us kind of think, form memories. What happens with these neurons is with a brain injury, they twist and they shear, and then they get damaged. And so what ends up happening is that's where kind of the brain fog comes from, is those neurons are just no longer functioning like they should. And then so when you get that twisting, that shearing, that's kind of like where you feel, I don't really feel myself, or I kind of feel out of it. I'll share a story. During my third year of residency, I was playing basketball here at McConnell. Jake Hesse, a great trauma surgeon now, ironically, ran me into the wall, had a concussion. It was 6 weeks before my boards. And I was fortunate, it took me a couple weeks to heal. But Dr. Hamama actually sent me home from rounds. She said I wasn't making a whole lot of sense, but I thought I was. But
no way.
Yeah, it was kind of a funny story looking back. But so anyway, it can take time. Unfortunately, as we get older, as my fellow men over 40 years old, it takes a little bit longer than in kids. Usually with kids, they're a little more resilient. Usually within a week or so, they can get back to normal. But usually it can be very scary, some of those symptoms.
Our hardcore crew fans might recognize Dr. Moneme's name. Actually played for the Columbus Crew back, you said, in 1996 for a season. I'm sure that, all the headers that you had to take, and you're going up for contested balls and your whole entire career, you must have had some concussions along the way. Can you tell us about your journey with the concussion?
Yeah, I think it always happens. I think it's part of the game in some ways. I think the interesting thing is, even now in youth sports, they've kind of made heading is a foul for the younger kids, knowing that even subconcussive blows that aren't big hits that kind of make you lose consciousness can result in concussion and concussion-like symptoms. So every head ball, every challenge, there's some risk. You learn ways to try to protect yourself to minimize risk and minimize injury. But, I also think things have changed. Back when I played, you kind of got your bell rung and, you might have been dizzy, but they threw you back in.
Right.
And I think now that we recognize the physiology behind concussions and the fact that not letting your brain rest and recover can cause bigger problems down the road, that we're much more aware and we're much more likely to try to protect our athletes. So.
Yeah. from a sports medicine perspective too, Dr. Bring, I mean, you watch some players who get their bell rung and they'll immediately grab their leg because they know, oh, if I have a concussion, they're not going to let me play. From a sports medicine physician perspective, that's what you're there on the field to be keeping a close eye on, to make sure if you see something, you immediately pull these kids off for some examination. I think it's a really important part that we've kind of graduated from what Dr. Moneme was saying of this, just rub some dirt on it, you'll be fine perspective.
Well, and, we've seen the state legislature for this too, which has been great to back us up, where we have the ultimate authority to pull a kid, especially if we do suspect a head injury. And that's been very effective. I think that the best thing that's happened, though, over the years is the education that comes with coaching. I know I coach some of my kids' youth sports, and we have to do concussion training, which is great. So all the coaches now are getting trained in recognizing signs and symptoms of concussions, but then also understanding when the medical staff, our athletic trainers or team docs, when you step in and you say, hey, this kid's got a concussion, we're able to pull them out. I know there's been some pretty traumatic head injuries in the NFL over the years. I know we've kind of seen some of the severe injuries, where we'll even see some of like the fencing sign, which shows a deep neurologic brain injury in some of those athletes. And obviously those are the things we want to avoid, especially in kids. 99.9% of these kids are never going to play professional sports. And so, I tell these kids this, like, look, you have your brain for the rest of your life. Regardless of what you go into, you only get one. You got to take care of it. You got to protect it. What's really interesting, though, is, I'm curious to hear Dr. Moneme's thoughts on this, too, is the micro trauma of the headers over the years. In us regular athletes, not the non-professional ones, I always we've done a lot of studies on chronic traumatic encephalopathy in professionals, but not as much in the day-to-day, like the kids that maybe played high school soccer and then they go on, and live regular adult lives. So that's another really interesting area of research, I think, is that CTE. They call it the chronic traumatic encephalopathy for like long-term risk of depression, anxiety, Alzheimer's, dementia, those types of things. Yeah,
Dr. Moneme, what are we risking with that long-term injury?
Yeah, I mean, I think there's lots of research in this space, and it's an interesting place to kind of think about how we treat our athletes, right? And I think, once again, we get so concerned about the big hit, and we forget about kind of this chronic subconcussive hits. The football player who trains and practices helmet to helmet every day. And the interesting thing from a physiology perspective is we even know that even these proteins called microRNAs that get secreted in the brain after head trauma. So within a minute after a head trauma, your brain actually starts to change chemically and affect protein production. And you can actually, and we've talked about it in the past with concussions, with saliva testing that we've explored for diagnosis. So they've even done studies about athletes over the course of a season and how the protein and how the metabolic profile can change with these subconcussive blows compared to the big hits. So there's certainly some physiology about how these things can, remodel and change brain function over time. So
what about mouth guards? I mean, I remember when I was playing hockey, there was a big push to keep that mouth guard in your mouth. It's not for your teeth necessarily. It's more for a concussion prevention method. Heads up, don't duck was the slogan. If you're going into the boards, keep that head up. But mouth guards, I mean, have we found that to be effective, or is it sort of a myth?
I think it's effective. It's interesting. I think in the last concussion conference in Amsterdam, they talked about the fact that mouth guards can reduce the risk of concussion by 30 to 40%. Simply just limiting head-to-head contact in practices has a really significant impact in reducing concussion. So I think there's value to these different tools. And I think really with these young kids, anything you can do to limit their risk is a positive and a benefit.
I think equipment's a big part of that too. My son plays hockey in high school, and I try to get him to put his chin strap that's right up against it and nice and tight. He always tells me, hey, the cool kids like to have a little hang on their thing because it looks better. And I'm like, yeah, but if you get hit, that's so loose, you're going to have some problems. Can we talk about equipment? I mean, we've seen some really good advancements, I think, in some of this equipment, but if the kids aren't using it right, they're not really getting the full benefit, are they?
As far as concussion prevention goes, I've still not seen anything, I think, on the market that completely prevents concussions. I think that's what we're still in the search for. When I was in medical school down at Virginia Tech, one of my mentors, Dr. Gunnar Brolinson, led this area of concussion research, especially with helmets. So they built these helmets with these accelerometers, and they've been doing research for 25 years now on Virginia Tech football athletes on when they get a head injury, how fast were they going, what were the angular forces. et cetera. And we also did force plate testing on these athletes, where we would have them do not only the impact testing on the computer, but also force plate testing, where before and after we would kind of measure the X and Y axis of how they shift their weight prior to even starting hitting. So it's been really cool to see the technology improve over the years in those helmets. Unfortunately, they still don't 100% prevent concussions. The other thing you'll see a lot in high school kids are these Guardian caps. Kind of looks like an inverted helmet that goes on top of the helmet. And again, I think every year we go back and forth on this. It might mitigate some risk. I think that's the key statement here. Is it may decrease your risk a little bit, but it will never completely prevent it. Right. And then the third product, this one's been kind of cool. I actually knew the guy that developed this. It's called the Q collar. I don't know if you've seen the Q collar. It's kind of like a plastic collar that goes around the neck. In theory, basically what happens is it occludes your jugular vein, thereby increasing your intracranial pressure just very slightly. So the guy that developed it was in the military, and he always said, well, how come, woodpeckers don't get headaches or woodpeckers don't get concussions? And they look, there's actually a muscle inside the woodpecker's neck that occludes the jugular vein. So when it's pecking, it doesn't get that increased pressure doesn't cause the brain sloshing around that kids get. So, and again, I was looking up the studies on this morning. It doesn't completely prevent it, but it can potentially reduce risk. I know Cincinnati Children's has done quite a bit of work in that space.
Good luck finding a smarter podcast than this one.
I know. I'm learning so much.
Yeah.
This is amazing. I'm benefiting from this
I love
because
it.
my kids are, behind yours in the sports world. This will be my world someday, and I'm so glad I know this information. We actually got a couple great questions on social media about concussions. So rapid fire, we'll throw these out there. The first one, if you suspect a concussion, where should you go? Do you go to urgent care? Do you go to the emergency department? Do you call your primary care? Where do you go?
That's a good question. I think, the lay person, we always say you shouldn't be a doctor or a neurologist and make a diagnosis, right? So I think if someone's having symptoms, it's always okay to call a medical professional for advice. I think that's number one, and I think we'd never want anyone sitting at home trying to make a diagnosis. That being said, as a neurologist, we look for focal neurological problems. So when patients have a concussion and we see things like weakness, we see bruising around the eyes or behind the ear, we see facial drooping. So they're very specific kind of neurological symptoms that get us concerned that there's something more serious than a concussion. And the biggest thing is bleeding in the brain, which can happen with severe enough trauma. So I think from a neurology perspective, if we're not hearing those focal deficits and someone's having headaches, dizziness, balance problems, the other classic concussion symptoms, we feel pretty comfortable with, talk to your primary care doctor, have a plan for observation, and within 24 to 48 hours, you would like to hear that there's improvement of symptoms. And if there's not, then there's a real reason to kind of go in and get further evaluation. That's a general guideline.
Yep. How does that impact like a return to play, right? When should you start to say to yourself, okay, you need to be out for this long? It's hard because it's such an individual situation.
Yeah, do you want to handle that one?
So we look at a tool called the SCAT-5. So it's the Sport Concussion Assessment Tool. Basically what the SCAT tool allows us to do is look at symptoms. So we have 22 different symptoms graded 0 to 6, 6 being the most severe. So at the time of concussion, our athletic training staff can be very effective with this. And so this is where I feel like it's great to have physicians on the sideline so we can do that detailed neurologic exam, because if we do see changes in, if there's more nystagmus where the eye kind of twitches back and forth, or there's pupil dilation or something that looks abnormal, we use what's called the GCS score that can kind of help us with this too, to see if a kid needs to go to the hospital urgently. If not, we stick to the SCAT-5 where we can do those symptoms and then kind of track them. So going back to your question about return to play, for me, for a high school kid, if you have a concussion tonight's week 1, and you get a concussion tonight, it's a very low probability you're going to get back for that week 2. Now, could it happen? Absolutely. The only way it could happen is if they're symptom-free basically tomorrow morning, we progress them through a normal week of practice, and they're symptom-free throughout the whole week. And that's really the biggest thing we look at here is symptoms and, what other things are occurring. And this is really hard because we have to have our high school kids. My son's he just turned 12. They may not be as honest with you as you would like. So they may lie and say, no, I feel fine. It's week 8. We're in the hunt for the playoffs. But this is really where you got to talk to kids and parents and say, hey, you have to be honest with us so we know. There is some interesting data coming out. So when I trained, we just did, 5 days of rest with gradual progression back to activity. Now what they're showing is early signs of, walking or getting out and moving can actually help get those symptoms down a lot faster, doing some light activity.
Yeah.
Interesting, because I've always heard like darkness, stay in a dark room.
Definitely a change. That's definitely a change. And most recommendations now coming from the most recent concussion guidelines, 24 hours of rest, 48 hours of no screen time. And after that, there should be a return to activity, light walking. And in the past, we used to say any symptom you stop. There's a sense that mild symptoms are okay to work through because that helps you with your progression of return to play.
Interesting.
So I think there have been some changes and recognizing that kind of strict bed rest with no activity actually could be detrimental for recovery if it's too long and prolonged.
Interesting.
Really interesting.
Yeah.
The other quick question we got from social media was, if you suspect you had a concussion, even as far as like a year ago, should you still go get medical advice?
I think so, absolutely. I mean, the long-term effects of concussions can be damaging, especially in adults. When you look at especially if you have underlying risk factors, depression, anxiety, ADHD, head injuries can actually be prolonged if you have some of those pre-existing conditions. And so I'm a big believer in that, especially with mood disorders, because concussions can actually make mood disorders worse. So the longer that you wait and sit on those, that could be a detriment to your health down the road as well.
I know we're talking about the traditional places where you would see concussions, football field, soccer field, those kind of things. I kind of want to transition to where else you could see it. I think one of the maybe underreported things that people don't think about is kind of like the dance teams or the cheerleading teams. Like, these kids are doing flips and they're doing a lot of different things.
Or like workplace injuries.
Yeah, in workplace spaces. We do see concussions outside of the traditional playing fields a lot, don't we?
Agree. See them everywhere. I think it's recognition and awareness, and I think to your point, education. We focus on sports and contact sports because we think the risk is higher, but I think there are all these different environments where people are at risk. And I think, really educating people about the signs and symptoms of concussion, what are high-risk activities, I think those are important. And then also, being mindful of symptoms, and if you are at work and it's not a physical environment, but you still have some type of trauma, there really should be some type of assessment.
Yeah.
So interesting. I've learned so much so far.
It's been great.
I mean, I thought that a concussion was, like walking into this podcast today, I'm telling you, my impression of a concussion was you passed out right away or you started puking and then you were shunned to a dark room. Like that was my thought on it. And or I remember playing hockey growing up, there would be a collision and you'd have this one saying, I got it. I'm good. I'm back in, coach. And then they hit the ice and they fall down. That's been my take on it, my only experience with it. And so it's so exciting to hear that the research keeps going and you've discovered more and thought, hey, maybe this wasn't as effective before. Let's try this. I want to ask you both, what's your hope for the future? Where is the research still needed?
Gosh, that's a loaded question.
Yeah.
I mean, I think for me, from a sports standpoint, the equipment is definitely the way to go. The rules, especially in soccer, have helped quite a bit too. I think mitigating that risk of head injury. I played sweeper in high school, and we were always taught to head the ball directly out of the air off of goal kicks or punts, and I wonder about that too. So I think the other research, which I'm personally excited to learn about, is for the everyday athletes, people that may not have played professional sports or professional football, but like played a little bit of football or soccer, and then you get older, and how do those micro trauma, those hits, kind of add up as you get over time. And then from an equipment standpoint, too, I think if there's anything out there that could, again, continue to help reduce risk, I don't foresee any product ever being able to completely guarantee no concussion risk, but, finding ways to mitigate that risk is going to be the best thing.
I still tell my kids to put a helmet on. I mean, they're
Always.
12 and 15, and I'm like, they walk out the door on their scooter. I'm like, do you have your helmet? right?
Yeah.
I mean, you cannot risk
Electric
it.
scooters.
Yeah,
Electric
Cow.
scooters.
Yeah.
all over the place. No, I think diagnosis from a neurologist, right? We like to diagnose things. Having better tools to really differentiate between the people who are high risk and low risk would be great, right? And I still kind of go back to that whole concept of this saliva testing. Would it be nice for a sports medicine doc to have their exam on the field, but also have a biomarker of some sort to kind of say which are the people that are high risk, right? Because a lot of times it's borderline, right? And you've got a kid who, I mean, if you get hit, yeah, you may feel a little dizzy. Is that really a concussion or is it not? And right now we err on caution and everyone sits out, but could you get better at being able to differentiate, which are the people who really should be out versus the people who aren't? And also with the long season. Yeah. Who are the people who suffered more injuries in a long season and need more care?
That's what I was going to ask you, too, because we see often in the NFL, just because it's visible and we see it, but I'm sure it happens in other sports, even in the high school spaces that we don't see, I don't personally see, is you get one concussion. Are you more susceptible to get more concussions if you're rushing back? Or even in general, are people more susceptible to get a second concussion if they have a first one?
It was funny. I was reading incidents of new concussions. The chances of a high school athlete per 100,000, it's actually more likely that they'll get a first concussion compared to a repeat concussion. Now, I also say if you get back to return to play too soon, then that definitely can increase your risk of a second head injury. Most severe is what's called second impact syndrome. So this is where you get dangerous brain swelling and you can die. And this came up a couple of years ago. There's been a couple of isolated high school football cases. Again, kid gets they say, oh, you just got your bell rung, get back in there. Kid takes another hit and then is running and all of a sudden just passes out and dies right there because you get dangerous brain swelling and bleeding. And once you get that cerebral edema, our skull it can't expand, and so that can be a very, very dangerous thing. So that's the biggest reason. That's the thing I tell these kids. It is life-threatening if we don't pull you out right now.
Yep.
I was just having the conversation this summer with friends of mine, and the husband's a college football coach. He's got 2 sons, and they're about almost Pop Warner or youth football ready, right? And so we were having that discussion, and I said, "Are they going to play youth football?" He's like, "You know what? I don't think so." And I was surprised to hear that because football's in his blood. I mean, he has a cousin who plays in the NFL. It's what they do. And he's like, I think we're going to start with flag football because I'm truly concerned about head injuries, especially younger. So is there benefit to starting kids a little bit later? We have seen a decline in youth football registrations across the country. We're seeing an increase in, flag football as the alternative. What's your take on that?
Cumulative effect, right? If we're talking about subconcussive blows and hits and how they affect your only brain that you have, would you want to start developing trauma or directing trauma to that brain at an early age, right? So I think it's just protecting your brain. And I think whether it's football, soccer, softball, any sport, dancing, you really want to just say, let's protect your brain, right? And if you don't have to hit your head or directly kind of put yourself at risk of trauma, it's better to avoid it.
As we kind of wrap up, is there a message you want to leave folks with as we kind of go back out into our regular lives? I think this is going to be a really well-received podcast because it is one of those topics that everybody wants to know a little bit more about, I think. As we kind of wrap up, what messaging would you want folks to take back with them into their daily lives, into their kids' lives, and those kind of things? Dr. Moneme, let's start with you.
Yeah, I probably have maybe 2 things. Number one, concussions don't show up on MRIs. Right, and I think that's one thing as a neurologist that we get a lot of information and questions about. I need a brain scan. To Dr. Bring's point, concussions are metabolic. They're neurochemical. They don't show up on scans. It's very rare for us to see anything related to a concussion on a scan, right? So I think really kind of getting out of that mindset that I need to get a scan and focusing more on symptoms is the most important thing for identifying concussions. And then number 2, concussion rehab therapy works. And I think in our young athletes and adults who have suffered concussions, we have a great OhioHealth program with comprehensive concussion rehab, balance, headaches, cognitive function. And, really what I see in my clinic is sometimes people wait and they sit at home, to your point, in a dark room for a week, and they don't do anything for a couple of weeks, and they come to me and I say, I wish someone would have gotten you into concussion rehab therapy sooner, because we know that those types of interventions help people return to work and return to play much faster. So I would, if you're still symptomatic within 7 to 10 days after a concussion, I really think that, leveraging with your PCP or a specialist to get in for some rehab really provides a lot of benefit.
Dr. Bring?
Yeah, just kind of build off of that too. I think education is really important. So if there's ways in which schools can provide education to families and coaches, it makes the conversations a lot easier when parents especially have had that education on concussions. When I first started as a resident doctor covering high school football games, I got yelled at by he was having double vision after a hit. That has not happened. That was more than a decade ago. That has not happened since, and I think a lot of that's because of education. So that would be my first thing. And then the second thing too is, there's the myth of, well, I just have to, or the myth of like I have to wake you up every hour for neurologic checks. That can actually be pretty dangerous too. So once a kid has been teenage kids, I always say this is the time where it's okay, to stay in that dark room, no screens, but then also that early activity. And just to clarify my point earlier, for some teenagers, if I say light activity, they say, well, that's a pickup game of basketball.
Yeah.
What we're saying is, maybe a brisk walk outside with some sunglasses and not a pickup game of basketball with your friends. Yeah.
Interesting.
I wish we had like 2 hours to spend with you. I mean, I think we're going to have you back because I do think that this is an always evolving conversation. And as you both know, you're finding out new things every single day in the research and you bring it to our audience. And I think it's so valuable. So it's been great. Thank you so much.
Thanks for having us.
And thank you to our listeners. If you enjoyed today's episode, subscribe to The Wellness Conversation wherever you get your podcasts.
And before we wrap up, if there's any health and wellness topics that you want us to cover on the podcast, we certainly would love to hear from you. You can drop us a comment and like and subscribe. It also helps us get the word out to our new listeners.
This episode transcript will also be available on the podcast page. So if there's any information you'd like to go back and read about, you can find us at ohiohealth.com/thewellnessconversation. As always, thanks for joining us.